Hi, I'm Chris Bolin. I'm an acupuncturist at Del Sol Community Wellness Center. And today I want to talk about germ theory versus terrain theory. These are two theories that came out of the 1800s. Germ theory was presented by a scientist. His name was Louis Pasteur. And it's his theory that led to what is commonly known and accepted in Western medicine today as treatment for most of the illness that we have. It's his theory that led to what we use today, what doctors tend to use today: drugs, chemotherapy, antibiotics, surgeries, radiation, vaccines. Those things came from this theory. And his theory, which is the common narrative, it's what you're going to hear most of the time. It's what's commonly accepted. It's what we hear in the media. It's what we hear when we go to the doctor's office. And this is the germ theory. And so, through the wonderful invention of the microscope, we were able to discover germs, microbes, things under the microscope that you can't see with the human eye. And from this theory, they decided that the answer would be to kill the germs, that this is how we can stay healthy and remain healthy and safe in our environment. And the goal was, or is, to have a sterile environment. Kill the germs, we have a sterile environment, we remain healthy. And we do this, and this is common. You can walk down any aisle in the grocery store with household cleaners, and most everywhere you look, you're going to see germicides. Things like bleach, Lysol, hand sanitizers. These kill the germs, and then the idea is to keep us safe from the germs. The drawback to this is that most of these germicides are toxic not just to the germs, which is the idea, to kill the germs, but it's also toxic to us humans, to our pets, and it can cause a lot of issues in the body, which again, this is not being or staying healthy. It can cause headaches, it can disrupt our hormones. A lot of these have been proven to have cancer-causing agents in them, and it can also cause liver toxicity. And these germicides also are non-discriminatory. They don't just kill the bad guys, they kill the good guys right along with it. And so in our environment, we don't just have, bad germs and bad bacteria, but we also have good guys out there that help us to stay healthy, and it kills all of that. Along with, a lot of the other treatments that are used, the chemotherapy, the antibiotics, it's kind of like an army coming in and just annihilating everybody. They kill the bad guys and they kill the good guys right along with it, which can set us up for ill health and for, being vulnerable to things in the future. And also, it's unrealistic because literally we are surrounded with microscopic bacteria and virus and microbes and fungus and all sorts of things in our environment, and it's unrealistic to think that we can create and sustain a sterile environment, where we live and anywhere that we go. There is a unique word that captures this. It's called nosocomial, and this word means that it's a hospital-derived sickness. The hospital makes the greatest attempt to create a sterile environment. No one tries harder than hospitals to create that. And yet, there's a word that captures that was created just to capture something that was derived from a hospital, a sickness, an illness that came from just a hospital. So, does it make sense? Are we really able to sterilize our world? Is that the answer? And this can also be fear-based. we're living in fear. We're afraid of our environment. We're afraid of going outdoors. And this in itself, fear can lower our immunity. It increases stress, and that, can lead to ill health just itself. And so, we kill germs, but also we can try to avoid germs. It's real common today. You see most people walking around with masks, trying to avoid, breathing out their germs or breathing in someone else's germs. And, is this effective? On the label of most boxes for the masks, the common masks that you see, it actually says this does not prevent viruses. The kind of gear that you would have to wear, what I'm saying? It would look kind of space age. That's not something that we can as humans practically maintain. And then wearing the masks, we increase our CO2. We're breathing more CO2 in, which causes our body to be very acidic. It lowers our oxygen intake, which is vital for not just our survival, but also for health and for healing in our body. And then it increases bacteria. We're wearing this mask against our mouth all day where it's moist. And, it only takes a couple hours before the bacteria just starts to proliferate. And so it increases our risk of getting sick just from these bacteria. And a lot of people, we have our disposable masks, but we wear them for hours at a time. And some people wear their homemade masks for days at a time without washing. Not a safe and not a healthy choice, I think. And then you have gloves. And so the idea is that we're keeping the germs off our hands. But if you watch most people, they're still touching a lot of things. They're touching this, and then they're touching that, and then they're touching their face, their eyes. And so, it may not be very practical. And you may be spreading just as much germs with your gloves on and literally just keeping them off your hands, but not particularly stopping the spreading from one area to another of germs. So the next theory I want to talk about is terrain theory, and this is talking about our inner terrain, or what we commonly know as our immune system. And the scientists that did the study on this and came up with this theory was Antoine Bichon. And I'm not sure if I'm pronouncing that right, but that was my best attempt. So this is our immune system. This was something that is an incredible design our Creator gave us. It is how our body wards off and deals with all these things that are in our environment. We have incredible defense systems that are in place. And so I want to talk a little bit about these. They say in the sports arena, I'm not a sports fan, but they say the best defense is a good offense. And this is what our immune system is. First of all, we have our skin. Our skin is covered with an acid mantle, which it can be antimicrobial, antibacterial. It is our first line of defense against foreign invasions. And we also have good bacteria that lives on our skin that also acts as a defense. We have the underlying fatty layer that is a defense system. And, anything that comes to us has to first penetrate through this first layer of defense. And then we have mucous membranes. They line our sinuses, they line our lungs, and mucus can engulf and capture and help defend us against invaders as well. And then if we ingest anything, it has to get past the line of defense of our hydrochloric acid in our stomach. This is a huge factor, and for people that take antacids, it's one of those things that can shut down that line of defense and cause ill health in our body and really make way for things to invade our digestive system. And then we have the wonderful flora that lives inside of our body, what we commonly refer to today as the human biome. And these are friendly bacteria that live along our digestive tract that are an incredible line of defense against foreign invaders in our body. And then we have the white blood cell. And this is this beautiful microscopic defense that we have against invaders that can attack, that can dismantle, and just do this incredible job of killing off things that make its way into our system. Our body has this memory system built in, so when we're exposed to something, it remembers it and it sends out a specific attack and cells that destroy specific invaders in our body. It's an incredible, incredible way of defending against invaders. And so, you know, we have the germ theory and we have the inner terrain theory, and this one tends to be more of a holistic focus. This is more of a common narrative. This is what more people are familiar with. This one tends to be more of a holistic focus. And it is this area that a lot of our holistic practices today focus on. And we here at Del Sol, we have body work and we offer acupuncture, and these things help to bolster and to strengthen the immune system so that we can fight against and win this war against all these, you know, foreign invaders and these things that can cause sickness in our body. If you have any questions about either of these theories, about how holistic health in general or the things that we offer here at Del Sol can help you, then you can contact us. Our email is hello@delsolcommunitywellness.com. Again, my name is Chris Bolin, and thanks for listening.